Well, welcome to Skin, Hair, and Nails PowerPoint presentation. This is Professor Ulrich. There are many different types of skin problems, and the book touches on just a few of the more common ones. Remember that you can tell a lot about someone's health by assessing their skin. The skin has many functions. It helps protection, helps maintain homeostasis, temperature regulation, sensory organ, vitamin synthesis, and psychosocial. The Langerhans cells present in the skin phagocytize foreign substances that invade the body when the skin is injured, which alerts the immune system to an invasion. Assessment. With assessment, you want to make sure that you get a thorough patient history, which includes demographic, socioeconomic, drug, health status, allergies, nutrition, any family history of skin problems, and assess patient's self-esteem and body image. Inspect and palpate hygiene and cleanliness, skin color, pallor, cyanosis, erythema, jaundice, uremia, lesions and vascular changes and markings, edema and hydration, and integrity in hair and nails. Don't forget to assess the patient's body language for cues as to patient self-image. Remember, one of the functions of the skin is psychosocial. If a patient has a skin condition that makes them self-conscious or have a negative self-image, that can lead to social isolation related to fear of rejection by others. Some Some more specific questions related to developmental stage. Remember, your questions should be age specific, and also ask if they are pregnant, if there's been any changes, or if they have any frequent falls, and also about their environment, the external and the internal of their environment. Some questions for assessing hair and nails. The hair, ask them to describe their hair now and in the past. Any grooming patterns, loss of hair, medications, or if they pluck or wax. With nails, compare now and 2 months ago. Also, check and if they've had any infections in their cuticles, they're taking any over-the-counter meds, artificial nails, or hands in a lot of, if they're in the water a lot, what kind of job that they have that maybe they need to wash their hands a lot. Physical assessment of skin, hair, and nails using inspection and palpation, and always try to assess in an organized manner. And here's some tips. Keep the room warm. Make sure that you provide privacy and monitor own reactions. Be aware of that and respect religion and cultural norms and need direct sunlight to adequately assess skin. Always remember to first ask for permission to do an assessment and explain what the assessment consists of. when lifting the breast, use the back of the hands.
Normal findings of the skin, it should be clean, and hair too, and nails, they should be clean, free from odor. With the hair, there should be no even distribution. The nails should be pink undertone. They should be free of odor. With the skin, should be moist, warm, and smooth. Remember, in assessing dark skinned patients, you need to have really good tangential lighting. Note hygiene, color, and also their anxiety, their reaction as you are assessing their skin, hair, and nails. Inspection of the skin, hair, and nails. Again, remember that you'll want to assess the temperature, moisture, the texture, thickness. Also check the feet and ankles for any edema, swelling, and hair again for the texture and the distribution pattern. And the nails, make sure that you check the capillary refill. That should be 2 seconds.
Lesions. It's important to understand the difference between primary and secondary. Primary is initial reaction to a problem that alters one of the structural components of the skin. Examples of macules, plaques, and cysts. Secondary are changes in the appearance of primary lesions. Crust, fissures, lichenification are some examples. Shapes of lesions. Always identify and document. Are they circular in shape or are they annular, like ringworms, or confluent lesions that run together, like hives and urticaria, or discrete lesions that are separate? Or are they grouped? They appear in clusters. Are they linear? They appear to be in a line. Here's some examples of athlete's feet, and also eczema on the hand and fissure of the anus. When assessing the skin, also look for ecchymosis or drainage, color, odor, consistency, amount, whether it's scant, moderate, or copious, which means abundant, and location. Also ask the patient to describe sensitivity and also their pain. Assessment of lesions. Try to remember the acronym just A, B, C, D, E. A being, is it symmetrical? Is there symmetry of shape? Or B for border, is it regular or irregular? Color, is there variations within one lesion? The diameter, how big is it? How wide is it? How long is it? And also evolution, is there changes? Educate patients to perform TSSE on a monthly basis, which means total skin self-examination. Types of skin cancer. This is a squamous cell melanoma carcinoma and also squamous cell carcinoma. Here's another example. And basal cell carcinoma, melanoma of the face, and melanoma of the back. Some common skin conditions: xerosis, dry skin; pruritus, itching; erythema, redness, usually from sunburn; and urticaria, hives, exposure to allergens. Before treating any of these common skin conditions, always check the doctor's orders or ask the patient what they normally use too, and what has worked and what doesn't. Sometimes we do need to put mitts on patients' hands so that they don't scratch. We want to educate them to keep their nails clean and trimmed. With hives, take away any allergens, treat with antihistamines, educate patient not to mix alcohol and antihistamines. So, pressure ulcers. What are pressure ulcers? Where is the pressure? What is reactive hyperemia? Hyperemia, dilation of the superficial capillaries. If it's blanchable or non-blanchable, we indicate if there's tissue damage. Understand the stages of pressure ulcers, which is covered in your Fundamentals lecture. What is the difference between partial and full thickness of wounds? Remember that partial superficial involving damage to the epidermis and upper layers of the dermis. Heal by re-epithelialization or primary intention, whereas full damage extends into the lower layers of the dermis underlying subcutaneous tissues. And how do pressure ulcers occur? Where tissue compression from pressure restricts blood flow to the skin, resulting in reduced tissue perfusion and oxygenation, leading to cell death. Usually in patients with limited mobility or prolonged bed rest, sensory impairment, friction, shearing, and excessive skin moisture due to incontinence or sweating, inadequate hydration, or malnutrition, especially low on protein, which is needed to aid in healing, and alter mental status. By using an assessment tool to identify high-risk patients and then implementing a preventive program, you are being a patient advocate. An assessment tool commonly used is called the Braden scale, which is pressure mapping, visualizing, assessing patients' skin and pressure points. Prevention program usually encompasses repositioning at least every 2 hours or more often if patient is bedridden, especially beds that turn on their own that we use, and also we have overlaying air mattresses. Sometimes we use pillows for padding. Always want to assess and reassess frequently. Parasitic disorders, pediculus, infestation of human lice where hair is located in the scalp, groin, armpits, or anywhere where hair is needed to change linens and clothing. Get a new brush or clean the one that patient used with chemical agents as well and is treated by chemical killing agents. Scabies are contagious skin disease caused by mites. You'll see ridges in the skin. Patients usually complain of itching. Usually seen in patients with poor hygiene or crowded living conditions. Treat with scapicides and washcloths and personal items. Do not share combs or any towels between patients. Make sure every patient have their own personal items. So, a quick review. Remember to always assist all patients with limited mobility to change positions at least every 2 hours while awake. Assess and always reassess frequently. Evaluate pressure ulcer risk for all patients on admission and regularly thereafter. Be proactive in the use of pressure relieving devices. Use a lift sheet or mechanical lifts to move immobilized older patients rather than pulling or dragging them across bed linens. Keep skin of patients who are incontinent clean and dry. Touch the patient who has skin problems to show acceptance. Avoid rubbing any area of the skin that has been subjected to pressure. Also, please be familiar with the 32 key terms listed in your textbook, page 181.